Welcome back, everyone. During the break, we were visiting a little bit about how this is a tough conversation to have. People are sensitive about their weight, and addressing this can be scary. So, but what do you tell people who say, I don't even know if I want to hear what you have to say?
Well, again, as a practicing physician for 30 years in family medicine and working with patients, being comfortable about talking about sensitive subjects with patients is critical. And weight management, and for patients to learn about the impact of carrying excess body weight and what that's driving in terms of their disease, it's important because if the medical professional is comfortable talking with patients, patients perceive that. They understand that this is being done in a non-judgmental and this is a health issue. That's what it is. Whether they always say whether your weight's a health issue or whether your health is a weight issue, either way it's about your health. And so being comfortable talking to patients and helping them understand that, again, so many times it's felt to be their fault. People are taught that it's their fault, and this is not. This is a disease process, a chronic disease. We're born with a weight, and we're going to go out with one, and it's a matter of how do we help manage that healthfully while we're here. And so helping patients learn how to choose and make these decisions, and the impact that it has on the other diseases, being able to manage those medications and those disease processes as we help them lose weight properly so they get rid of the adipose or fat tissue that's generating the disease. That's really critical, because as patients learn that they can do this over time, get rid of body fat, hold on to lean mass, the muscle, that's crucial because that's what keeps them healthy.
You know, one of the pervasive things going on today is diabetes, especially type 2. So what do you guys do for a type 2 diabetic?
Right, and you know, scary enough, 1 in 3 new diagnosed type 2 diabetics are now teenagers. And so I think approximately 20 million children in this country are struggling with increased body weight. And so when folks come into us, depending whether or not they're on insulin or just oral medications, the biggest part of our program is we want you to feel comfortable. Like Dr. Berry said, we don't judge, we don't scold, because we treat it matter-of-factly, that it isn't about the way you look. Yes, that's a side effect with weight loss, is you're going to feel better about your appearance. But we treat the diabetes with nutrition versus let's keep throwing a bunch of expensive medications at you that, yes, can help bring down the blood sugars, but that's not the root of the cause. What puts sugar into your bloodstream? The sugar that you're eating. And understanding, we teach you how to choose those foods more wisely so that you can better stabilize those blood sugars and hopefully eventually come off some of that diabetic medication.
Yeah, you know, it's interesting, in the first 3 months that I started, when we started this practice about 6 years ago now, we've been doing this. And in the first 3 months of practicing, I discontinued more medication for patients than I had in 25 years of practicing medicine. So that's the impact that this has. And so as patients who are out there, if they're listening and they're on many medicines and struggling, we can help them actually decrease the amount of medications they need and get healthier. Most importantly, get healthier, better quality of life, better quantity.
To both you, great stuff. Thank you very much. Check them out, FargoMedicalWeightLoss.com. If you have questions, comments, and stick around. Much more coming up right after this.